Hey everybody, nice to see everybody here today. We have Dr. Keith Yimoyines on is joining Tolk Wellness Center. As a naturopathic doctor and Lyme specialist, Dr. Keith believes in treating the body as a whole and has years of expertise in treating patients with Lyme disease. Today we will be discussing the latest news on ticks and Lyme disease in Connecticut.
So thank you, Dave. We're going to be focusing on some of the newer threats to Connecticut as far as ticks and tick-borne diseases. Some new ticks have come onto the scene that carry some viruses, bacteria that are unique to Connecticut. So we did our presentation on Lyme in April. We covered some of the very common infections. We're going to talk about some of the ones that are being newly introduced and should really be on the radar of practitioners in Connecticut. So let's get right into it. So first thing is recognizing ticks. So here are the ticks that are common to our area, the ones that we're very familiar with, the black-legged or deer tick, the dog tick, and then the less common ones. And then the two new ones we're going to be talking about, new to Connecticut and the Northeast, are the Lone Star tick and the Asian longhorn tick. This is where we tend to see the distribution of tick-borne disease. You can see Connecticut is covered on all these maps. We have Lyme disease, Babesia, which is a parasitic malaria-like infection that is common in the Northeast and the West Coast and scattered throughout the country. Ehrlichia, which we'll talk a little bit about today, in Anaplasma in the blue. Tick-borne relapsing fever in the orange, which is similar to Lyme disease, but slightly different. Bartonella, which causes cat scratch disease, which is tick-borne and flea-borne, also common to similar areas. And the Rickettsia species, Rocky Mountain spotted fever, and a new Rickettsia that we'll be talking about today. You can see Connecticut is on all these maps. So I think that's the point I'm trying to get across. So as I mentioned, we have two new ticks to the area. The first is the Lone Star tick, named for the white star-like spot on its back. You can see there. And this is a tick that's very common in the southeastern United States. It's responsible for about 90% of tick bites in the Southeast. Now it's made its way up, which isn't surprising given, how travel-oriented our society is. Things spread fairly easily. So we have them in Connecticut, New York, Rhode Island, Massachusetts. The first colony was established in Connecticut, Norwalk, in 2017. And since then, we've seen increased submissions to the CAES. So the CAES is the Connecticut Agricultural Experimental Station. And what they do is they're responsible for both taking tick submissions from the public and testing those ticks and keeping very, very good records of what they're finding and what tick-borne diseases they're finding in those ticks. They also have started doing surveillance. They'll go around and trap ticks and collect them and do research. They've been a wonderful resource for doctors treating Lyme and tick-borne diseases. The Lone Star tick is very aggressive. It likes to bite people and carries Ehrlichia, Teleremia, Rocky Mountain spotted fever, a couple of viruses, Bourbon and Heartland virus. We'll talk more about those as we move along. The one we're not going to get much into is starry borreliosis. That stands for, I just had it in my head, Southern Tick-Associated Rash Illness. And this one, I'm not going to expand too much on because very little is known about it. It causes a Lyme-like rash. You get the bullseye rash, very similar symptoms to Lyme disease, the joint pains, the fatigue, the headaches. But it's unclear exactly whether it's caused by a bacteria that's related to Lyme disease or Borrelia, or whether there's some other cause. They have found that antibiotic treatment is effective in a lot of cases, so, but it hasn't been determined exactly what the causative agent is. The Lone Star tick also causes alpha-gal syndrome, That is that red meat allergy that people may have heard of. And I've actually seen that several times now in my practice. So it's fairly startling, but 4 to 6 hours after eating beef, lamb, pork, patient gets very ill, nauseous, mostly can break out in rashes, and there's a pretty simple way to test for it, but that tells me, that we do have some of these ticks in the area. So I think I've had 3 patients who've had alpha-gal allergy. The other tick that's novel to the Northeast is the Asian Longhorn tick. This one is native to Asia and not as aggressive as the Lone Star. The one concerning thing I mentioned on bullet point 2 is that females can reproduce without a male. They can reproduce just by feeding and can produce 2,000 offspring, and can carry Japanese spotted fever, which is related it's a rickettsia that's related to Rocky Mountain spotted fever, can potentially carry Lyme, Babesia, Anaplasma, Ehrlichia, and Powassan virus. And the concern here is that, we're just starting to kind of understand what this tick can carry. And pay particular attention to the appearance of these, because it is really important. I mentioned the CAES on a prior slide, but if you find a tick, Lone Star, really any tick, but especially one of these novel ones, you want to send it into the state to get it tested, and they can verify what it is and what it carries, and that'll give doctors moving forward more information on what exactly we're dealing with.
Is there a specific procedure for people to do so? Because I honestly don't know that procedure.
There is, yeah. So we'll get to, I think it's later in the presentation, I will,
perfect.
Yeah, I'll run through that, what exactly you have to do to prepare it, because they do have some procedures to follow, so the tick is intact when they get it, and they can test for it if they need to.
Perfect.
So the first kind of novel tick-borne disease we'll talk about is Teleremia. It's rare, but a potentially fatal bacterial infection can cause very severe illness from days 3 to 14 after the bite. It's spread by ticks, other insects. Mosquitoes are actually the largest vector for Teleremia. Hunters are at risk because you can actually get this from the blood of an animal who's infected. People who do a lot of gardening, it can live in the soil and you can actually breathe it in. Don't stop going out and gardening and doing all that, but if it's breathed in, it can cause a pneumonia, a very severe lung infection. Also infects the skin. If it gets in the eyes, it can cause a major issue and will cause swollen lymph nodes, and essentially it'll present like a severe infection in any one of those areas, and is treatable if you catch it early. I don't see this one much in my practice in like a chronic form. I've tested some people for it and found they may have had it in the past, but I haven't seen much of this one. Ehrlichia, which is more common here in Connecticut and is carried by the same ticks that carry Lyme, the deer ticks, and of course the Lone Star tick, which we're talking about. Symptoms are pretty similar to Lyme. Will be sudden fever, headache, muscle pain, joint pain. Testing is widely available for this. And it can be a mild infection. The body fights it off and you never really have an issue. I see in a lot of my patients that they've potentially had this in the past, or it can cause a very severe Lyme-like infection. So if you get this one, it's verified on blood testing. The treatment is antibiotics. The people I see who it may be lingering in their system, will do herbal protocols to help clear it out for good. The rickettsia species, so here are your Rocky Mountain spotted fever, Japanese spotted fever. So the Rocky Mountain wood tick spreads to the Rocky Mountain, obviously, and the Asian longhorn tick, the Japanese spotted fever. This is a sudden fever, chills, severe headaches, and a rash, a spotted fever. It will cause a widespread rash. It doesn't look like the Lyme bullseye. It's a more diffuse rash. And I see some of this in my practice. You want to, again, treat this very promptly. Obviously, if you have these types of symptoms, you would go to your doctor, and they would be looking at this as a possibility if you have the right kind of rash, essentially. And then we get into some viruses. So you have the Heartland and Bourbon viruses, which I mentioned earlier. They're kind of grouped together. I put these all on the same page because there's still a lot to be learned about these viruses. They all cause a variety of symptoms: fever, fatigue, lack of appetite, headaches, nausea, etc. They all come with generally low white blood cell count, platelet counts, which you would see just on standard blood panels. They're fairly rare, thankfully. Testing is difficult. In some cases, you can look at what the immune system is doing in response to these. There's no test to look for, the virus in the bloodstream, but you can look at the immune response. And the Powassan virus can be extremely severe, has caused a few deaths in the state, will cause seizures, meningitis, encephalitis if it gets into the nervous system. So that's the big concern there. Luckily, again, it's extremely rare. There's no established treatment regimen for these. It's supportive care. You'd be hospitalized if you had severe illness, and you're just going to be supporting the immune system. But as of now, there's no protocols essentially for treating these. And
so sorry, is this one more of a product of they have a tick-borne disease because there's no direct test and everything else, so it's kind of like a elimination type of thing?
Yeah, exactly.
Everything gets eliminated, and this is the one that kind of holds its head above water at that point.
Yep, pretty much. So you're if you get meningitis or encephalitis, they're going to test for all sorts of infections. And yeah, by process of elimination and looking at the antibodies that the body's making in response to these things, they can figure out what's going on and administer the proper treatment, which at this point is still being researched because they are so rare. So prevention, stands for all of these tick-borne diseases. So when you go hiking, you want to stay on the trails. You want to avoid tall grasses, wooded areas. Nobody actually does this, but they should tuck their pants into their socks. You do? Okay, good. Dave, I
go out and play frisbee golf, and I look like an idiot, but I don't care. I got my pants tucked in.
Yeah, I was reading a study the other day on how few people are actually willing to do that. But yeah, white socks, light colored pants, tuck them in. You want to get there are all sorts of tick repellents commercially available. You want to find one with cedarwood oil or the other ingredients. Cedarwood oil base with some of the other essential oils. They're more toxic, DEET based repellents also, but I tend to just go with the natural. And then when you get home from your walk or your hike or gardening, wash the clothes immediately, check yourself. Ticks like to hide in the folds of skin. They like to hide in the hairline and in the hair, ears, check everywhere. Throw those clothes in the washer, dryer on high heat for 30 minutes will kill most of the ticks. And animals your pets can bring ticks into the home. So you want to make sure that your pets are protected if they're indoor, outdoor, going indoor, outdoor, cats, dogs. And birdhouses can attract rodents that can carry ticks. And you can also treat your yard. There are all sorts of companies. I don't have a specific recommendation, but that do natural tick treatments for your yard. Keep your grass short, and you can make tick tubes that will attract ticks and kill them. There's instructions on Google if you just Google how to make tick tubes.
I will comment on the tick repellent. I use just the essential oils like Wondercide, and
Yeah.
I find them to work as well, if not better, than the ones with that have DEET and all the other chemicals that you're not exposing yourself to. I don't see a recognizable difference between using one or the other. So
Yeah, I tend to agree, and just the idea of using a toxic chemical
yep.
on myself and my children is not very appealing to me. So.
Yep, that's why I wanted to highlight that I find I get the same result with
Yeah.
one or the other. So
Absolutely, absolutely. Okay, and here's where we get into kind of what to do when you find a tick. So you want to be gentle with it. The CDC, the Centers for Disease Control, will say that a tick has to be attached 24, even 36 hours to transmit these infections. It's not true. Really, any amount of time that the tick is attached, there's a non-zero chance, I'd like to say. So there is a chance that it could transmit something to you. So you want to be vigilant about checking, getting them off as quickly as possible, using thin tipped tweezers, grasp as close to the mouth as possible, pull out gently. You don't want to stun the tick in any way by burning it or putting alcohol on it or hydrogen peroxide or whatever other petroleum jelly I've heard to smother the tick. You just freak the tick out basically and make it release its stomach contents into you. So that's really worst case scenario. That increases your chances. Don't grab the tick by the body, again, grab by the mouth. And then, before I move on to the rest of this slide, in the days following, you want to be proactive. Give your doctor a call. Tell them that you've been bitten by a tick. What should I do? What should I be looking out for? Because, all these things have, similar but different symptoms. Any sign of fever, any headache, any joint pain, any sort of rash, whatever it looks like. You want to be proactive. I'd say even before any of those symptoms present, you want to call your doctor and just kind of make them aware. Some doctors will be very proactive. I tend to be very proactive with natural treatments and will, based on what the patient is telling me, length of how long the tick has been on, how long ago the tick bite was, try to assess any symptoms. Then we make a decision together as to are antibiotics appropriate, are herbs appropriate, is a combination, is homeopathy appropriate, are there things we can do topically within the first day to help prevent infections. So there are a lot of options you have right when you have that tick. I actually use in echinacea and golden seal preparation on a tick bite, and that can help with prevention of the infections. And then to send the tick to CAES, the Connecticut Agriculture Experimental Station. They want a crush-proof container they don't necessarily want a plastic bag because the tick get crushed, but they want something that the tick will remain intact throughout transit. They don't want anything else in the bag. Again, there shouldn't be any alcohol or hydrogen peroxide or anything else in there. They don't want the tick on tape.
So let me ask you, if you had someone get bit, would you want them to send the tick, or would you want them to bring the tick to you so you had a chance to look at the tick?
I would just have them send the tick immediately.
Perfect.
Yeah, because the lab will send you back in short order what kind of tick it is, what disease it carries. And there are instructions if you just Google CAES, Connecticut. There are instructions as to how to send the tick and what information you have to give them, and then how long the testing takes to come back. And then tickreport.com, there are other private companies that will, for a fee, test more of the infections. So I think Tick Report will test for 20 or 30 things, including Powassan, including some of the other viruses we talked about. They can do DNA testing of the various infections. whereas the CAES will only look for Lyme, Anaplasma, and Babesia, which is good, but not terribly complete. But again, they're doing really good monitoring and providing good information. So you can look at some of the private companies too. And Tick Report's my favorite. And then, so for treatment, I mentioned, prompt treatment is really the key with any of these things, whether it's Lyme, whether it's the common co-infections, whether it's one of the novel ones, it's all about prompt treatment. So being really proactive because, I see the population, a lot of the population I see have been suffering with Lyme for, years to decades because they didn't know they had it. They weren't treated promptly enough. Maybe they got it 20 years ago when the protocols were a little bit different and they were given a single dose of antibiotics. You really want 3 weeks of antibiotics if you're going to go that route. And basically, I use some combination of herbs, both anti-inflammatory or antibacterial, antiviral. So this is kind of the list of the antibacterial and parasitic, or I'm sorry, protozoal, that's a Babesia. These are kind of the herbs that you would use to actually kill off the infections and being proactive again. And then working on inflammation. So Japanese knotweed, cat's claw are kind of staples of my protocols with treating both acute and chronic tick-borne diseases. They bring down the types of inflammation these infectious agents cause. And then Stephania for neurological inflammation, kudzu for neurological inflammation, and then there's some herbs for immune support. There's a list there. You basically pick based on which infections are present, what symptoms the patient is experiencing, and you pick and choose. You're not on 16 different herbs. You pick the ones that are going to work for that particular case. When you're treated with either antibiotics or herbs, for an acute infection or a chronic infection, you could feel worse, have a die-off reaction that, especially initially, starting a few days after you start treatment. And basically, it's an exacerbation of the symptoms you already have. You feel worse before you feel better. You could also have, fatigue, joint pains, headaches. Here's a list of recommendations that I give to people for staving off that Jerish Herxheimer, and that's something I talk to all my patients about. And then there are some dietary recommendations that I give both acute and chronic. So you really want to clean up your lifestyle. I do a lot of food allergy, food sensitivity testing on my patients to find out what they may be sensitive to, what's causing inflammation in their systems. Common ones being sugar, alcohol, gluten, I could go on, dairy, soy, corn, etc. These are things that people tend to be sensitive to, but as you test more and more people, you see that you could be sensitive to lettuce. So that's why that testing is valuable. And then clean up the gut. So probiotics are very important with either antibiotics or herbs. You want to make sure that the organs of elimination are healthy. That includes the gut. So that's part of the Jerish Herxheimer reaction, where the body's detoxifying. It's trying to get rid of dead bacterial tissue. It's trying to get rid of the toxins that Lyme releases when you kill it. So the gut has to be healthy. I get everybody on a good anti-inflammatory diet, get them to go outside, get them sun while avoiding ticks, walk outside barefoot, meditate, do yoga, Tai Chi. I like the float tank. That's why I include that.
That's everything. All right.
That's everything.
Perfect. So we want to thank Dr. Keith for coming on here and talking about all the new information and stuff. And I'd like to share that Dr. Keith is also available for a 15-minute consultation on Fridays. And we are actually adding patients to a waiting list as he joins the Tolk Wellness Center in August. To learn more about the Lyme disease or hear a recording of this webinar, please email us at tolkchiro@gmail.com. to receive a link. We will also be adding this webinar to our website and sharing it on our Facebook and Instagram. Be sure to follow us and for more educational webinars in this coming months. Thanks, guys, for showing up.
Thank you, Dave.
Yep. Does anybody have any, do we want to take questions or anything like that, Keith? Or
I could.
yeah, if anybody has a question, if you want to, I don't know if you want to type it in or unmute everybody or to try and see if
I'll go to chat. If anybody has a question, they can type it in.
Perfect.
Okay, so we have one question, or two questions. The first is ticks and pets. So fortunately, my dog is, and most people's dogs are actually vaccinated against, I believe, Lyme, Anaplasma, and Ehrlichia. And so they can get tick-borne diseases. The bigger concern for me is, so if your dog is acting odd and has, is acting lethargic, looks like it's struggling to get around, any sort of abnormalities in that sense, vets are very good at spotting these things. The biggest concern for me is, ticks getting into the house and fleas getting into the house also because of the risk of Bartonella, cat scratch disease. So definitely treat your pets for ticks and fleas. And I have another question: is Ehrlichia known to clear once treated or linger? So I've seen both. Again, I think that the key is prompt treatment. I've seen it more often be the case that I'll find evidence of a lingering infection. And you get into kind of the nitty-gritty of lab testing at that point, because there can be some confusion into how to actually interpret antibody testing, which is how you assess a lot of these things. You look at what the immune system's doing against the infections, and there's a textbook way to look at antibody testing that says if you have these antibodies, it's an acute infection, it's still there, or you're flaring. If it's this type of antibody, then it's a past infection. You don't have to worry about it anymore. It's just a lingering kind of artifact of an old infection, and it's really not all that simple. So you can see these things linger, you can see them last or reappear on that type of testing. And at that point, you have to go with your clinical intuitions a lot of times. That's very important to find a skilled practitioner in that sense. And eventually you can clear these infections. So I've seen both with Ehrlichia. It can linger, or it can, if treated promptly and properly, can be resolved. One more question. How do ticks affect different age groups? Oh, that's a great question. So I see some children in my practice. Also, I see all ages. And I'd say that the biggest differentiation is between children and adults. So if kids are infected very, very young, and there's evidence that Lyme in particular can be passed on from mother to fetus. So that's important to realize. I see those kids present with more of the learning difficulties, mental emotional symptoms. They'll have some of the maybe joint pains and headaches, maybe muscle pains, but a lot of it is affecting the brain. And so that's the major difference I see between children. We're talking the under 10 crowd, and most other people will respond the same after that age. Some people are more prone to different effects of Lyme in particular, and other tick-borne diseases too. So if you're more prone to inflammatory conditions, you have a family history of an inflammatory condition, I'd have more concern that your Lyme or other tick-borne disease is going to manifest as an inflammatory condition. So I think I answered that.
Okay. Well, thanks,
Okay.
Keith, for giving us all that informative information. And thanks for everybody for showing up. And you guys want to catch it, if you missed part of it, it will be up on the website or on Facebook and things like that. Okay, guys? Thanks, everybody.
Thank you, Dave.
Yep.